5 signs you might be skinny fat. When it comes to your health, the mirror and the scale tell only part of the story. You may consider yourself fortunate if you've always been a healthy weight without having to work too hard. However, the mirror and the scale only tell part of the story. You might look beautiful in a bikini and have a normal BMI, but if you don't take care of yourself, you could be just as unhealthy as someone who is fat. According to one 2008 research, this phenomenon, also known as skinny fat or normal weight obesity, affects up to 1/4 of adults of normal weight. They appear healthy, but when we examine them, we find that they have significant amounts of body fat and inflammation, says Youre, MD, head of the UC Davis Health Systems Laboratory for Atherosclerosis and Metabolic Research. You wouldn't realize they're at significant risk for diabetes and cardiovascular diseases based on their appearance. The only way to tell for sure how metabolically healthy you are is to get your blood pressure, cholesterol, and blood sugar levels examined. However, there are several indicators that might help you figure out if you're at risk for normal weight obesity. If you have any of these features, talk to your doctor about how you can stay physically fit on the inside and out. You have a muffin top. Even if you're a healthy weight overall, sporting a spare tire can be dangerous. In fact, a recent study in the Annals of Internal Medicine found that normal weight people with excess fat around their middle had an even higher risk of dying early than their overweight or obese peers. Dr. Youre states, fat around the midsection is worse than fat anyplace else. In terms of insulin resistance and inflammatory proteins, it's where the harm begins. And because this type of fat doesn't come all at once, it's simple to overlook. If you're gradually raising your belt size or your clothes start feeling tighter around the waist, that should be a red flag. You can't do a push-up. Even thin people might have a lot of body fat, especially if they don't have a lot of lean muscle mass. This may be you if you can't recall the last time you worked up a sweat. People who aren't overweight don't have the motivation to exercise and be in shape, Dr. Youre explains. However, they will become increasingly unwell if they do not exercise regularly. Maintaining a healthy heart and lungs requires frequent aerobic activity, such as brisk walking, cycling, or running. Regular strength exercise, on the other hand, can help you gain muscle, rev up your metabolism, and burn harmful fat. You have a family history. You may be genetically prone to diabetes, heart disease, high blood pressure, or high cholesterol if a parent or sibling has developed these problems, regardless of size. Maintaining a healthy weight will reduce your risk, but only if you do it in a healthy manner, through exercise and a well-balanced diet. Consult your doctor to learn about additional methods to avoid health issues that run in your family. Even if you live a healthy lifestyle, you may still have risk factors, such as high blood pressure or high blood sugar, and drugs may help you manage them. You don't eat a healthy diet. Maybe you can eat burgers and drink drinks without gaining weight. Perhaps you keep track of your calories but prefer white bread and junk food than fruits and vegetables. In any case, too much sugar and fat, as well as the lack of vitamins, fiber, and lean protein, can harm your organs and increase your risk of diabetes, heart disease, cancer, and other diseases. According to Cynthia Sass, Road Health's contributing nutrition editor, yo-yo dieting, skipping meals, and radical cleanses can all contribute to skinny fat syndrome. That's because when you are hungry and overeat, you gain body fat, but when you significantly limit calories, you lose muscle mass, a poor combination that wreaks havoc on your health. You're in an at-risk population. BMI isn't a perfect measurement for anybody, but research shows that it may be even less effective as a predictor of general health for some ethnic groups. According to a 2011 research, persons of South Asian ancestry are more prone than Caucasians of the same BMI to retain extra fat around their internal organs. Visceral fat is a form of fat that surrounds organs and has been linked to metabolic issues and chronic illness. Genetics obviously have a part in how people retain fat, Dr. Youre adds, but culture and nutrition probably play a role as well. And certainly, no matter what your risk factors are, Eating well and exercising is beneficial to everyone. According to a 2014 research, elderly people should pay less attention to their BMIs. Because we lose muscular mass as we age, it's usual for older persons, even those of normal weight, to have high body fat percentages. The study indicated that focusing on muscle mass rather than obsessing about the number on the scale can help older persons live longer and healthier lives. Disclaimer: this video is solely meant to provide general information and does not address specific circumstances. It is not a substitute for professional advice or assistance, and it should not be used to make any judgments. For the diagnosis and treatment of any medical issues, a professional physician should be consulted. Any decisions you make based on the information in this report are your own. If you're looking for weight loss secrets, have a look at this.